Welcome, everyone. I'll just wait a moment as everyone makes their way in. Hi, everyone. Welcome to our session. Thank you for coming, and thank you to the Gender and Sexuality at Work conference for inviting us to speak today. My name's Jami Jones. I use she, her pronouns. I'm the Manager for Education and Engagement at Rainbow Health Australia, which is part of the Australian Research Centre in Sex, Health and Society at Trobe University. I'd like to acknowledge that even in our disparate Zoom engagement with the conference, that we're all on Aboriginal land. I am zooming in from Wurundjeri land, part of the Kulin Nation, and I pay my respect to elders past and present, and acknowledge any Aboriginal or Torres Strait Islander people here today. This always was and always will be Aboriginal land. So Rainbow Health Australia, just briefly, is a program, like I said, that's part of ARCHES, the Australian Research Centre in Sex, Health and Society at La Trobe University. And our role is to support lesbian, gay, bisexual, trans, intersex and queer health and wellbeing through research, and then the translation of this research into practical tools like training, resources, policy advice and service accreditation through Lgbtiq, which will be what we're talking about today. So Lgbtiq is a quality framework that supports the health and wellbeing, or supports health and human services organisations to create services and organisations that are safe and welcoming for LGBTIQ service users, staff and volunteers. The first iteration of Lgbtiq in 2013 really was tailored to address the issues of service users. It did not look closely at the needs and issues of staff and volunteers. And then we started to address that gap, or that lack of content and support for organisations in the area of organisational support for staff and volunteers in the 2016 revision of the standards and the guide to the standards. And we've recently released a new revision of the Lgbtiq standards and guide, and a whole range of resources and more information about Lgbtiq that you can find on our website. And I encourage you to go and have a look. There's a whole treasure trove of stuff there. And I want to just pause our conversation about Lgbtiq. We have this fabulous panel who've generously agreed to come and speak about their experiences with Lgbtiq. And they'll speak after I've given a brief presentation to provide a bit of context today. So what do we know about the experiences of LGBTIQ people in the workplace? Unfortunately, it's been relatively common until recent times, or in fact, it's still relatively common for LGBTIQ people to hide their sexuality or gender at work. And like I said, many people are still doing this. Private Lives 2, which is a study out of ARCHES, the centre where we're based, in 2012 found that 38.8% of respondents reported occasionally or usually hiding their sexuality or gender identity at work. So still very common. And we know from other research that, the impact of this is great. Whether LGBTI people feel safe and welcome to be open about their gender identity or sexuality at work can impact their mental health, their job satisfaction, as well as productivity, creativity, innovation, and a whole range of other flow-on measures, experiences of this. So I'm just going to speak briefly about some of the data that we do have about the experiences of LGBTIQ people in the workplace. So Private Lives 3 is the third study of the health and wellbeing of LGBTIQ people in Australia. And I'm using it because it's a very recent set of data from 2020. It's a national study, it's Australian data, and there was quite a large cohort of participants, so 6,835 people responded to the study. So employment, full-time employment. The study found that cisgender men were most likely to be in full-time employment. 50.6% of those who filled out the study were in full-time employment, followed by cisgender women, quite a lot less, 35.2%, and then less still trans women, trans men, and the least likely to be in full-time employment were non-binary participants, with half as many of those people being in full-time employment than cisgender men. Interestingly, or like a key finding was that 16.1% of the participants reported being unemployed or not able to work, which is more than double, in fact, almost 3 times the kind of national average of people who report being unemployed or unable to work. So there's a really huge disparity there in the levels of unemployment in the LGBTI community as compared to non-LGBTI community. And again, like within that data, there is a difference across the genders in their experience. So unemployment or being unable to work was most likely reported by trans women. So they were the most likely to be unemployed. 31% of those people were unemployed, followed by trans men, non-binary participants, cisgender women or cisgender men. So as you can see, cis men, only 10% of those reported being unemployed. And in terms of volunteering, not in terms of numbers, but in terms of identities, it's almost the inverse. So non-binary participants who are the least likely to be in full-time employment are the most likely to be volunteering. And you see here that cisgender men are the least likely to be in volunteering roles. So feelings of acceptance at work, like I alluded to at the start of the presentation, you know, whether we feel safe or welcome at work has a huge flow-on effect across a whole other range of other measures. And this is the data analysed by gender. We're just looking at the dark blue column at work. So this is the number of participants who felt accepted a lot or always at work. So again, cisgender men are most likely to say that they felt accepted a lot or always at work, 68.5% of them, followed by cisgender women, 61%. Trans women, only half of the trans women surveyed said that they felt accepted a lot or always, followed by trans men, 48.8%. And the least likely to say that they felt accepted a lot or always at work was non-binary people, 43% of those participants. This is the same question, the same data, but analysed by sexuality. Again, we're just looking at the dark blue column that refers to at work. So gay respondents were the most likely to feel that they were accepted a lot or always in the workplace. So 69.6% of those respondents, followed by those who identify as lesbian, queer, bisexual, pansexual, something else, which was a whole range of other options to reply, grouped together for this analysis. And asexual people were the least likely to say that they felt accepted at work a lot or always when we're looking at sexuality. So a summary of these findings are, and that overall 60.70% of the participants felt accepted a lot or always at work. But like you can see from the data I just presented, there's a lot of diversity within that, you know, a difference across the letters of the alphabet. Cisgender men and gay identifying participants reported the highest perceived acceptance in their workplace. Multicultural participants were slightly less likely to report feeling accepted a lot or always at work compared to Anglo-Celtic participants. Participants who reside in a suburban area were most likely to report feeling accepted at work a lot or always compared to in other geographic regions, and more likely than the average participant, so 65.4%. Compared to those in outer suburban areas and regional cities and towns. And in fact, those geographic areas the data is almost the same. There's very little difference between the feelings of acceptance at work in those geographic areas. And then you see that in rural or remote areas, those people felt actually more accepted than those living in outer suburban or regional cities or towns in the workplace. Only 47 participants completed Private Lives survey who identified themselves as a person born with an intersex variation or a variety of intersex variations. So we can't assume that this data, it's not statistically significant enough to make broad assumptions across that community of people having that experience. But having said that, of those participants, 50% said that they currently felt accepted a lot or always at work. So what we can gather from this, what I gather from this, is that there are still inequities in workplace experience for LGBTI communities when compared to their non-LGBTIQ counterparts. That there are differences in workplace experiences across the LGBTIQ alphabet, as we saw in the analysis across sexuality and gender. That there are, but we still have not a lot of data about the experiences of LGBTIQ people in the workplace and how they intersect with other parts of those people's identities and experiences, other parts of themselves. So, for example, their cultural background, their disability, age, originality, etc. And I had to leave early to come to this session, but I was really interested to hear about some of the research in the previous study that does elaborate more about that experience for Aboriginal and Torres Strait Islander people. And you will never hear a presentation by anyone that works at a research centre that doesn't end with, we need to do more research, but we really do. And not just academic research, but, you know, appropriate, safe, anonymous workplace research on behalf of organisations themselves about the experiences and needs of these different intersections. And of course, this means different approaches. So, you know, what the workplace issues might be for someone who is bisexual may well be quite different to someone who is non-binary or trans femme or any number of other experiences. And so we cannot draw conclusions or make assumptions about LGBTIQ as a homogenous group. And just to lead us into our conversation that I'm really glad to be a part of and to host now, I would suggest that Lgbtiq is a comprehensive and holistic tool to support LGBTI cultural safety in the workplace. And to discuss or evidence this claim, I've invited along three very generous and smart panellists to have a discussion about their experiences of this. So some of the stuff that we will talk about in our discussion is how do we create safe and inclusive workplaces for LGBTIQ staff and volunteers? And what impact has Lgbtiq had on organisation staff and volunteers? And it is actually quite a pleasure to be invited to speak about this from the perspective of the workplace and staff and organisational capability, because we so often justify this work or speak to this work from the perspective of service users. And of course, that is really, really important. But yeah, this is a different and just as important angle. So I'm just going to stop sharing my screen and invite my panelists to make themselves known to us, and I'm going to introduce them. Okay. So Dr. Jane Daniels, she, her, has worked in the community services sector in homelessness services, alcohol and other drugs, mental health, children, youth and families, and family violence sectors. Working in executive leadership positions over the past 15 years, Jane has led large-scale quality transformation work to support inclusive service delivery and to align contemporary models of practice with the Lgbtiq standards. Jane led the introduction of Lgbtiq standards to the Victorian homelessness sector, family violence services, and is now focusing on schools and out-of-home care. Jane has championed Lgbtiq as the foundation for organisational and cultural change at both an agency and a sector level, and witnessed the personal and professional transformation that can be experienced by staff and volunteers through the introduction of Lgbtiq. Welcome, Jane. Thank you so much.
Thank you, Jami. Thank you.
We're also joined by Ruthi Hambling, who has 8 years experience working across the community sector in carer, aged care and disability services. She has extensive experience using Lgbtiq Guide within organisations, including as Lgbtiq Project Officer at Carers Victoria, achieving Lgbtiq accreditation in 2020. Ruthi is a training coordinator at Rainbow Health Australia for the How To program, which works with organisations to help them achieve LGBTI inclusion. We've stacked the panel.
Hi, everybody.
Hello. Hey, Ruthi.
And we have a third panellist. Sparklez, have you made it in?
Hello, yes, I am here. I apologise,
Yay.
I'm unable to turn my camera on.
That's okay. We can hear you, and that's fantastic. So Sparklez has been supporting, connecting, empowering, and celebrating LGBTIQA+ people across the Great South Coast professionally for over 5 years. Their workplace, Brophy Family and Youth Services, was successful in obtaining Lgbtiq accreditation in 2016, and recently again was reaccredited in 2021. They have a passion for creating safe, welcoming and affirming spaces for LGBTIQA+ people in schools, community and workplaces. Welcome. Thank you so much to our panel for coming along.
Thanks for having us.
Good to be here.
I'll start with this. I mean, I feel like your bio is really clearly background why you're here to talk about this today. And obviously we have a real scope of different experiences with Lgbtiq over your careers in different organisations. So different sectors, different geographic locations. So I know, surveying staff is part of the Lgbtiq process. And, a lot in addition to, I suppose, some of that data, kind of just broad high-level data that we heard about the experiences of LGBTI people in the workplace. What have you found when surveying staff? Like, what were some of the common experiences of staff in the workplace? What's the workplace like for LGBTIQ people?
Jami, did you want me to kick off? I'm happy to kick
Yes,
off
please.
and hand to my esteemed panellists. So I certainly think that there's, if I think about surveying and the process of surveying through the introduction of Lgbtiq, it's extraordinary that you can see the journey that staff go on over the course of preparation to go through to self-assessment and then through to full accreditation. In my experience in opening up those conversations when we're first introducing the concept of Lgbtiq or inclusive practice, it really does pave the way for staff to start to feel heard. But I certainly think in those early days, invariably some of the conversations that arise are really more about how staff don't feel heard or seen or safe. But just by virtue of asking those questions, that's certainly where those conversations begin. If you fast forward through, and I know in my experience, it could be anywhere between 3 to 5 years, you fast forward through to the surveying that takes place as you're preparing for accreditation. And it's a very, very different conversation that staff are having. And I think that that's testimony to the work that happens through the introduction of the standards themselves. But certainly the conversations that you have at the start versus disclosure, people feeling safe, people starting to really celebrate in a far more visible way is something that I think is really tangible through the introduction of Lgbtiq. And if I cast my mind back to when I was working in the homelessness sector in the very early days back in 2013 of talking about what is Lgbtiq and what does it do, I do remember having quite a few staff speaking to me quite confidentially around them feeling safe or not safe, and certainly not being open about their gender and sexuality through to achieving accreditation and being very much at the forefront of that visibility and championing the organisation itself. So I think surveying is obviously a critical part of the process, but it really does demonstrate just how far the journey can go for staff and volunteers in organisations throughout the course of preparing for accreditation itself.
Yeah, I absolutely agree with that, Jane. One of my reflections for what it's like for LGBTIQ staff compared to non-LGBTIQ staff versus like slash LGBTIQ staff who, you know, are questioning or aren't out within themselves or aren't out, I don't know that they're out. But yeah, one of the key differences I think is for the queer staff, there's that we're sort of operating from this position that it's non-inclusive until proven otherwise. Whereas I think for non-queer staff, they start from the place that it's inclusive until proven otherwise. And I find that to be a really interesting kind of difference in experience. It makes sense that people are informed by their previous experiences. And unfortunately, a lot of us haven't had, you know, or have had bad experiences in the workplace, or people have said things, you know, offhand things to us they don't realize aren't inclusive. So it makes sense for queer people, you know, to sort of be coming from that standing point. But I think when doing inclusive work within organisations, it really means that to make that first step, there's quite a lot that's needed to bring the non-queer staff along sometimes. And I've had a lot of questions around why is sexuality relevant at work? You know, why can't we just treat everybody equally and treat everybody the same? And, you know, whereas the queer staff really get it because they're the ones who aren't getting treated, you know, with the same kind of sense of celebration and, you know, sense of being seen and really being understood. Yes, that would be my main reflection. I don't know, Sparklez, what do you think about all that?
You've summed it up really nicely. It's that we treat everyone with the same mentality is quite prohibitive, especially when it comes to transgender diverse people, because what works for cis people won't work for trans people. So having that we treat everyone the same blanket rule is actually quite prohibitive in that trying to understand the difference around service delivery in creating a culturally safe environment for people who do experience forms of minority stress. So being aware that we do need to actively look at what systems are in place and how do they prohibit different aspects of our community from fully engaging.
Thank you all. And so maybe we'll go in reverse now, and I'll start with you, Sparklez. What, you know, going on from what you've said, like what are some of the key, like most common barriers that LGBTIQ staff come up against, challenges, you know, instances where the systems are not fit for purpose, where cultural safety, LGBTIQ cultural safety is not there?
There's the risk, obviously, that this is the queer agenda, that this is coming from a queer person. So, of course, they've got to be attached to this framework around inclusive practice. So, trying to get as much buy-in as possible from other champions and staff members in being able to create the importance around this conversation instead of just, again, being that one queer worker in a regional rural area that keeps pounding on about flying the flag. So how do we, I guess, create a space where more than just the one person is contributing to this conversation? So that was, especially in a regional rural area, that was one of the challenges that I came across was, once again, it's me who's doing this work with the pride flag. And I felt as though that I was just banging on people's doors, whereas being able to, I guess, have a team that can create a sense of community in achieving a standard is paramount in being able to create safety as a worker, but also for long-term sustainability as an organisation.
Yeah, absolutely. I think sort of embedding those sorts of champions, if you like, to avoid burnout is really critical. And I think from my perspective as well, Sparklez, you know, going back to that question, Jami, what is it like in the workplace for LGBTIQ people? I mean, here we all are, like working 9 to 5, what a way to make a living, you know, and then on top of all of that, we're also sort of putting in the extra miles, I guess, to champion these changes and support our queer colleagues or support queer clients, because we'll often, you know, be the ones to be called on. And I think on top of that, I've also, in previous jobs, it's going a few years back now, have sort of experienced that minefield of, and this was when I was a younger worker, so trying to navigate what is kind of okay for me to bring to the workplace as a queer person, and that there are some things that in some workplaces aren't deemed to be appropriate. Like I remember I was the first day in my job and I was talking to my colleagues about how we all had dogs. And, you know, one of them was saying how, oh, like, well, I let the dog up on the bed. And then someone else was saying, yeah, I let our dog up under the covers. And then I said, you know, oh yeah, me and my partner, like we let our dog up under the covers. And, you know, she's had her dog for, 10 years and he's a really old dog and he loves to cuddle up and we all cuddle up together. And it was like, I just suddenly, you know, that was I went too far with the kind of what was okay to talk about. And it was like, as soon as my colleagues were picturing me in bed with my female partner, like it was too far. And so I think, you know, it's you're constantly having to navigate where do you have to, stop yourself from kind of being yourself? Like how much of yourself do you keep from the workplace to stop people from, you know, finding that to be awkward? Where is that line? And I mean, luckily I now have workplaces where that line doesn't exist. You can, you know, we can talk about everything and it's really great. It's so freeing to just be your full self within your workplace, but it is a bit of a burden, I think, for LGBTIQ people to, on top of what, you know, all the demands of working, to also navigate that.
Definitely, and I would echo that just in terms of the concept of cultural load for LGBTIQA people in the workplace. Personally, my experiences of being in executive roles is I often am the queer executive, and I think talking like you were mentioning, Sparklez, about being the one that flies the flag, I think, again, for me, speaks to how critical the work is to really engage with our allies as well. Often, like you say, often it feels as though we're flying the flag and possibly, and certainly in leadership positions, I think I've felt an obligation to follow that flag, certainly for people within the agencies that I've worked in, feeling that it is my responsibility to be out and being very vocal and visible about that, particularly for people who aren't in as positions of power that I am. But having said that, it does come with that cultural load. So for me, I think the work that I've done at really engaging allies at all levels of the organisation, whether that's the board, the CEO, the executive, and other leadership teams as well, is just as critical. Just to not only make sure that it isn't just the leaning into the queer staff to do this work, but really broadening out the voices of support for inclusive workplaces as well, because I do think that there is incredible power in having people in positions who don't identify as LGBTIQA to say this is important, this is critical work, and in my experience that's made an incredible difference to the successful attainment of Rainbowtiq as well.
Yeah, thank you all so much for sharing. I think personal vulnerability coupled with that cultural load that you're talking about, Jane, are just some of the reasons that LGBTIQ people choose not to be out at work. You know, it's just extra layers and so on. And hearing these perspectives, you start to really understand why the data is as it is, you know, why it makes such an impact, whether we can bring our whole selves to work without, Ruthi, I think you called it the line, where there is no line, you know, the difference between working in a workplace where there's a line and it requires the work of hypervigilance compared to just the relief of being able to be ourselves at work. So Jane, when you talked about the difference at the point of surveying, you know, for staff, and I know as part of Rainbowtiq, you also survey service users, but from the perspective of staff, you know, try and fill in for us the gap. And I know it's a whole heap of work and it's really different in different organisations, but what kinds of changes were necessary, or have the organisations that you've worked in achieving Rainbowtiq accreditation, what are some of the most impactful actions that were taken to enable that change for staff between, you know, the kind of reticence or sometimes negative experiences when they first surveyed compared to their experience after? What happens in between?
Oh, that's about 3 to 5 years worth of work there, but I certainly think some of the things that stand out for me, probably the polarities of celebration and also zero tolerance around homophobia and transphobia as well. So I think having an organisation, whether or not it's around internal communications or external communications, to really commit to celebrating. So certainly the agencies that I've worked in, we've had a very strong commitment to participating in all calendar of events, whether or not that might be Ida Hobbit Day or Pride, and being really visible. So I think that on one half, it is around the agency really taking a stand, and any opportunity there is to celebrate and amplify the voice of LGBTIQA staff and service users. So I think that is a critical piece, and that certainly is something that I would expect to see throughout the course of preparing for Lgbtiq. But I think on the polar opposite of that, it's also about calling out homophobia, transphobia, biphobia when we see it, hear it, and feel it, and being really, really clear about how we address that. And I think that's where some of those really challenging conversations start to emerge through Lgbtiq, which can often be very, very uncomfortable for people, particularly where we're talking about performance management conversations or managing complaints that we might receive from staff. But I think, again, being very open and providing support for people who are supervising staff to address when there is homophobia or when there is transphobia at the moment of it occurring. And I think that's something that does require a lot of training and support and capability building, but it also, I think, sends an equally strong message to staff and service users about inclusivity, what we will tolerate, what we won't tolerate, and really staying consistent on that messaging. So I think throughout the course of preparation for Lgbtiq, whether it is about celebration and visibility, or whether it is about really staying true to that line of no, we have a zero tolerance approach to racism, bullying, homophobia, transphobia, biphobia, and being very clear about what that means when we see it. I think that, for me, is just as important, because for those staff that are sitting amongst their colleagues, you know, hearing that this is our policy and this is how we enact it, I think is equally as important.
Thank you. Ruthi, do you want to talk about, I guess, you know, in addition to that clear communication and setting a cultural bar and the leadership that you're talking about, Jane, there's also a whole lot of policies and procedures and, you know, the devil in the detail of practicality. I think people think a lot about the big process of cultural change, and that, you know, it's a huge part of the work. But then there's just often the practicalities get forgotten, like leave entitlements and whether your email matches your driver's license that you provided or your name that you use, that you've told them, you know. So yeah, it's a really wide-ranging process. What were some of the kind of devil in the detail processes that emerged in the work that you've done with Lgbtiq?
Yes, great lead. And I was thinking to talk a little bit about those, and totally agree with Jane that cultural safety is a really big part of it. And then, yeah, some of those detail things. What would I say? I mean, the first one that comes to mind is affirmation leave, and working to, you know, have that within the EBA, the enterprise agreement, within an organisation, to have that really locked in for staff who are affirming their gender, to have, you know, 2 weeks additional leave for them to take time to attend medical appointments or have time off work if they've had surgery, and just to navigate, you know, the nightmare that affirming gender often is, unfortunately, because, you know, there's just so many systemic barriers for people. Then, yeah, you sort of mentioned a few of them, Jami, like making sure that computer says yes, so that, you know, there are options to indicate pronouns for new staff members, and, you know, that all staff are communicating their pronouns. So as, you know, I mean, I'm not a trans person, but if I were, I can imagine if I was going into a workplace and no one else was stating their pronouns and I, you know, was the only person doing it every time, I'd feel really othered So I think it's really important to sort of embed those processes and normalize them for everybody. I mean, Sparklez, I'm sure you can talk a lot about this. Maybe I'll hand over straight to you.
No, I can't really.
Throwing you under the bus. Oh, sorry.
No, for me, the couple of the biggest barriers are around how do we create that sense that we do allow people to authentically and affirmatively walk into our service and be themselves. So a lot of the things that we did around creating the service was a lot around just doing it and then taking the consequences later. So I went around and I changed all the bathroom signs to gender neutral signage. Like, it's those little things like that, but just create discussions on discussions. You have meeting after meeting when all it takes is a simple sign just to go, what's in this room? Here it is. And also that, don't know how this leads on, but what we were talking about before with that cultural load, a lot of the time I'm delivering the LGBTIQ 101 sessions to new workers, and that is their chance to ask those stupid questions and find out what they don't know. But by doing so, a lot of that time I'm opening up to those microaggressions where people are just unsure and new to this. So how do we, I guess, create that sense of safety for a worker to present and work with other staff in creating that sense of inclusive practice?
Thank you. And so much of that work ideally is about embedding these processes so that they're standard, so, and with stuff like, induction training, is LGBTI inclusive practice or inclusive culture training provided as a part of every staff member's induction and so on. And the more that stuff is embedded in all the systems and processes of an organisation, the less burden there is on LGBTI staff in that organisation to do the work, and whether it's formally part of their role or not. Yeah, fantastic. And each organisation has to discover for themselves where they're at and what work they have to do, and the best way to apply this framework. And that is the beauty of it as a framework, is that it's not the answers, it's actually the questions that you need to ask yourself and your staff and your service users. How do we meet your need? How are we going now? And sense checking it as you go, and embedding that continuous quality improvement as well, so that we keep checking back in. It's not something that we do as a once off and then, right, we're good to go, because we all know what is good practice and process, and what's appropriate at one point in time or for one person is going to emerge, and is emerging all the time. And like I alluded to in the summary from the research, as well, how do we consider the intersections of LGBTIQ plus people and those other parts of themselves that they're bringing, into the workplace, that's part of their identity or their lived experience, their cultural background, their Aboriginality, living with a disability, age, a whole range of other things. So any approach needs to consider those things. We started talking about this the other day when we met. Does anyone want to talk about the value or experience of how we look at LGBTI cultural safety in the context of other kinds of safety and welcome? Ruthi, going to dob you in.
I think it's a really good question, because often I think accidentally individuals / organizations can sort of lump every part of somebody into, one understanding of cultural safety. And, sometimes, for example, you might see like a mission statement from an organization that says, where we endeavour to work towards cultural safety for Aboriginal and Torres Strait Islander and LGBTIQA plus communities. And at the bottom, there'll be the rainbow flag, the Aboriginal flag, and the Torres Strait Islander flag. And while I think we can borrow, things from each of the struggles and make sure that we have solidarity working together, I think we also have to be really careful to give space to each of those experiences. So I think it's sort of when you first threw to me, I thought, I'm not totally sure sort of which tangent to go on, because I think while there is a lot of solidarity between people who are experiencing oppressions, and that we can all sort of work together to work towards equality. But there was something in the chat earlier about the difference between equity and equality, and that was totally what I was getting at, that we want to make sure that we are meeting people where they're at and giving them sort of the support that they need to create that cultural safety for them. So I think there's things to kind of come from working together with especially Aboriginal and Torres Strait Islander communities and LGBTIQA+ communities in each of the understandings of cultural safety. And of course, there's going to be intersections of those too. But then I think it's really important within organisations for them not to be lumped together. And I remember being told, if you lift up a rock, and it turns out that there's a queerphobic and a racist thing underneath it, like make sure you address both of those. And I just thought, oh, what a burden of work to do. Like, I don't know that I can do all of that. And of course, I did do my absolute best to address all of those inequalities. When I saw things that could change, I did change them, but it's a lot of work. And yeah, I think that they shouldn't necessarily be lumped together. So no, Jane and Sparklez, what you think about that one?
Can I just add to that? I think it's a really good point. And if I reflect back on the early days of the Lgbtiq work that I was doing, I think, and you mentioned, Jami, and the standards from 2013, to be honest, there wasn't a lot of conversations around intersectionality happening then. We weren't talking about white privilege. I think now, fast forward to how Lgbtiq is being operationalised, or the conversations that it's engendering in organisations, we are talking about white privilege, we're talking about heteronormativity, we're talking about cisgendered experiences and how they influence our thinking. And so I'm more reluctant to say, certainly now, from the work that I'm doing now, at this stage of the journey for Lgbtiq that I'm working through, it's more about how we listen and how we create those opportunities for listening and engaging. So we're not coming from the position of, in my experience, I introduce a new diversity and inclusion framework to an organisation. It really is just saying, this is where we start. From a position of white privilege, I'm not going to be the one that's going to have, like you said, Ruth, all of those answers. But I think it's about recognition that there are multiple voices that we're talking about have to be amplified in these conversations. And certainly white privilege and heteronormativity are a core to part of that. And I think that's where some of those challenging and uncomfortable moments can lead to real change in organisations. But for me now, as opposed to 10 years ago, it really is about calling out where, even those of us that are part of the LGBTIQA community also come with a set of privileges as well. And what are they, and how does that influence the work?
Thank you all so much. It's 3 o'clock.
Wow.
So, I know, it flies, right? We could talk about this for hours.
Yeah.
Thank you all really for your generous insights. I'm sure that our viewers, participants, have found it really useful. Feel free to, I believe our contact's in the conference guide, so contact us if you have more questions. But we're going to answer some questions. Charlene, have you?
Yes. Hi, so my name's Charlene Edwards. I'm the Executive Officer at the Melbourne Social Equity Institute, and my pronouns are she and her. And I'd just very quickly like to acknowledge that I'm speaking from the land of the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging. So we've got about 10 minutes for questions. So and I'm sorry to have to interrupt this panel, because I could just sit here and listen to you for another hour, especially if someone bought me some coffee. But that would, it's been a really insightful and really just a pleasure to hear you talk about your experiences and the deep sort of knowledge that you bring to this. There are a couple of questions that from audience members. There's one in the chat and one in the Q&A that are sort of very similar. I think we could tackle that pretty quickly together. So This is about the Rainbowtiq accreditation. Is it only for health services, or can any organisation sign up to it? And are there any precedents for academic organisations who have been accredited in the past?
We get this question all the time, and we are actually working on our eligibility criteria, revising the eligibility criteria at the moment. Rainbowtiq was designed for health and human services, which in itself is quite a broad brief, I suppose. Really, any organisation, almost any organisation who wants to use the framework is there, it's free, it's on our website. There is a lot of detail there already. So you don't have to become accredited to use the tools and to find it useful and to do the work, to start making the change. And like we heard from some of our panellists, it takes a long time for organisations to make this kind of transformational organisational change that it often takes to be successful in accreditation. So anyone can use the tools. In terms of accreditation, it is for health and human services, and where there are organisations that might not fit really clearly into that brief, it's a case-by-case decision on behalf of Rainbow Health Australia and the accrediting bodies. So Quality Innovation Performance and the Australian Council for Healthcare Services are the two accrediting bodies that independently assess organisations to decide whether they can be formally accredited with Rainbowtiq. I hope that answers the question. Precedents for academic organisations? No, not to my knowledge, but we are constantly pushing the boundaries of this work. And I think that speaks to the fact that it is such a useful tool in so many different contexts that people are constantly saying, can we do that too? Which is really exciting.
Thank you. So perhaps some slightly less straightforward questions coming up. So a question from Andrew. Today we've heard about the power and need to degender workplaces. Can you see pushback from the LGBTI? That didn't roll off my tongue because it's a different way that I say it. So community where identity may be diminished in this way, or won't it matter? So I don't know if any of you heard the keynote at lunchtime, but I think it's referring to that presentation.
I wish I had been able to sit in the previous things.
I guess it's looking, they were talking about degendering workplaces, but is that, does that conflict with maybe what the LGBTQIA community want, or is it in line with that?
I would say my take on this is that it's about the assumptions that we make. So nothing is neutral or invisible. And at the moment, we're making gendered assumptions a lot in workplaces, spaces, toilets, etc., like lots of different systems ask us to gender ourselves, Miss, Mrs, Ms, all the forms, etc. And so I would say a process of, I wouldn't call it degendering, I'd call it pulling back our assumptions about gender and making space for more genders, in fact, potentially. So I don't see a conflict there. I do understand there is this kind of push-pull sometimes in conversation where everyone was like, well, why don't we just make everything gender neutral? Let's just ungender everything. And in a way, often that comes, I think, from a position of privilege where people are from people who are not assumed, whose gender is not assumed to be something they don't identify with. Mm-hmm. So when you have to push hard, fight hard to be acknowledged, to be seen as yourself, your own gender, that you are, then to have that degendered is sometimes a robbing of yourself, or like a disabling of bringing your true self into your work or into your space or whatever. So those are some of my thoughts. Anyone else?
I'm just going to throw in that it's around allowing the space to affirm myself without necessarily having to be assumed to be myself. So it's around creating that conversation around, do you have a partner rather than boyfriend, girlfriend? And allowing my space to be, yes, I'm a non-binary person in this world, and I want to see myself reflected in the workplace, in this community.
Yeah, I have a, oh,
Sorry. No, you go
first,
Ruthi.
Jane. Okay. Everyone has something to say. My reflections are that we're not quite there yet. And I think in degendering a space, it risks sort of a lack of action that I think is needed in order for there to be true inclusion. You know, that's sort of that classic quote that if you do nothing, then you're just reinforcing the already existing oppressions that, you know, that we all grapple with in society. And so my fear would be that in this idea of degendering workplaces, what that's sort of insinuating is like taking away that work and not doing anything, and therefore just relying on, you know, what currently exists within society, which I think is, yeah, very far from the equality that we were talking about earlier. What were you going to say? Sorry, Jane.
I was only going to add to that. I think just to echo Jami's point about, I think, moving into a space where we're opening up conversations about gender rather than degender for me, and creating spaces for lots of genders to come into the conversation is probably at the core of certainly of my work in Lgbtiq. And the only other point that I wanted to reflect on with regards to degendering, one of the things that I think agencies that I'm working with now are still grappling with in the intersectionality work that we're doing is that making assumptions around gender in relation to multicultural, multi-faith communities as well, and what that means for their experiences. So I think also coming to this work with a very westernized view of what gender roles are and how they are experienced in work is something that I don't think we've fully grappled with, and I'm certainly looking to use Lgbtiq to start those conversations as well, because I think, again, for me, at the core of some of those assumptions is very much a position of white privilege around gender too. So that I think that's probably where I feel there's some potentially more problematic conversations when we're talking about degendering rather than opening up the conversation about genders.
Thank you. We've got one last question and 1 minute to answer it. So I might just ask Ruthi if she'll respond to this, because it specifically refers to something you said. So you mentioned that it's important to encourage all staff members to include their pronouns. It is a recurring topic within TGD spaces that forcing people to announce their pronouns can be harmful. One might not yet know their pronouns or might not yet be out, and using their cis pronouns is not affirming, etc. Is there a way to accommodate around this?
Whoever asked this question, you're an angel. And yes, TGD stands for trans and gender diverse, for anyone who's wondering. And 100% agree with you. And the ways to get around it are making it optional. If you are here and you're working for some kind of educational institution, you can introduce yourself with your pronouns, but not encourage students or participants to introduce themselves, but provide it as an option. I think the important thing in this space, I think, is normalizing it so that if somebody does or doesn't want to share their pronouns, then that is totally okay. And yeah, it's a really, really good point that to be conscious of not forcing people to out themselves by sharing their pronouns.
Thank you. I'm afraid that's all we've got time for today. If we were in a room all together, I'm sure everyone would be clapping very loudly. Thank you so much again for sharing your experiences and your wisdom with us. And I think we're wrapping up this session. There'll be an afternoon tea break, and the next panel sessions start at 3:30. So thank you all again. And maybe next time we'll be able to do this in person.
Thank you, everyone.
Thanks for having us.
Bye-bye.